Some of the treatment that we use mainly the mood stabilizer, antipsychotic. So it's not recommended to start antidepressant for somebody with bipolar. So you have to make sure they are stable before you add an antidepressant. It's trying to track your daily activities, because when you're able to track your daily activities, you can tell when you are off, and then you know when is the best time to seek help. And because of HIPAA protection, it is recommended to involve family in crisis. The reason behind it is that family can intervene. They can call your doctors, when you have given them the permission to intervene. And also the family, they'll be aware when you're in crisis, because most of the time, like I say, some people will disappear. If the family is aware, they can call your doctor, they can reach out and see how they can, if it's time to adjust your medication and so forth. Keep a journal or any, at least make sure that you have somebody closer who will be able to tell when you are not doing well. And we also recommend to join a support group, not just for the patient, but also for the family as well, so they know when to seek help and when in times of crisis. The thing to emphasize more is that you really need to seek help. If you don't seek, I mentioned there is increased risk for suicide. 1 out of 10 people with bipolar disorder are going to commit suicide, and 1 in 3 will attempt. So they are going to try. So it is good to stay on medication. It's good to stay in a support group. It's good to stay closer to the family so they can tell, because this is how you see, especially with the Hollywood, and people will be like, oh, he was fine, he had everything, how did he commit suicide? It's because when they are in high, they are doing well, you can tell, and then the next morning they're going into that depression mode. They can easily commit suicide. That's what is going on. So that's why we need to stay closer. We need to monitor, making sure people are taking medication. The other risk factor is use of substance. Most people end up using alcohol, cocaine, fentanyl, and other substance use. So that's why, if not treated, these are the risks that you can run to. And lastly is the mania can turn into psychosis, and thank you for listening. Looking forward to the next episode.